Alright everyone, so today we're talking about male chest contouring, the condition known as gynecomastia. So we got Victor here, he's 24 years old, and about 5 weeks ago we underwent a procedure for gynecomastia, which include gland removal, as well as liposuction to remove some of the fat above the pectoralis major muscle. This is his result today. You can see how nice and flat the contour of his chest is compared to the before. Maybe if we pan out to the side here, you guys can see from the side how nice and flat that chest looks compared to his before. So go ahead and flex your pec a little bit. So when you flex, you can see the nice muscular definition that he has at the top here, and relax. And so now you can see all that retroareolar gland tissue is removed. He's got a little bit of subcutaneous scarring over here, which we talked about doing some massage to kind of soften up over time, which it will. But the incision for his gland excision looks really good. It's right in here. It's hidden where the areola meets the skin. So that is healing up beautifully. And again, nice flat contour of his chest compared to before. A lot of guys, we do a lot of gland removal and a lot of gynecomastia surgery for a lot of men. It's obviously a very an issue in terms of being comfortable, going without a shirt and that kind of thing. So it is a procedure that can significantly improve the confidence in men as well. So liposuction and chest contouring are definitely one of the most common procedures that men seek out to help with their self-confidence. So at 5 weeks, he looks great.
All right, guys, a couple things when we talk about male chest contouring. When you're evaluating the male chest, it's important to identify the muscle, the skin, the fat, and the breast tissue. In order to optimize the result, you have to be able to address all three issues. So sometimes, even in men, you have to do a small breast lift in order to improve the nipple position. So it just really depends on the situation. Breast tissue, if it's glandular breast tissue, you can't liposuction that. You have to physically cut it out and carve it out. So a lot of times when we do liposuction of the chest, we also leave behind glandular tissue, and that is the part that really needs to be excised. Otherwise, the chest will not necessarily be as flat as we can make it. So it's a comprehensive approach to male chest contouring. In his particular case, he did not require a nipple lift, but mainly most of his issue was glandular breast tissue, the thick, dense tissue that needed to be physically removed, which is what we did. We did some liposuction, but again, that was just a small component of his overall result. At 5 weeks, you'll notice his chest looks much better. There are some areas of slight subcutaneous scar tissue that we've talked about massaging about 5 minutes a day. That'll settle out nicely. So I'm going to see him back in about 3 months, and in 3 months, you'll notice those areas look even better. So you guys can appreciate at 5 weeks early on that the chest looks nice and flat compared to that breast tissue that you guys can see in his before pictures. So hopefully this content was educational for you guys. A lot of guys out there are afflicted with the so-called man boobs, and so surgery is a great option for these patients to restore self-confidence. Being on the beach, he's 24 years old, he's already noticing that his shirts are fitting him better, he looks better in shirts. You can't see the puffy nipples through the shirts. So big game changer for him in terms of his self-confidence, and it's going to help with his self-confidence on the beach as well. If you guys like this content, then definitely just subscribe to my YouTube channel, like us on Facebook, and definitely check out my Instagram page as well. So thanks for tuning in. And